Adam Finn, we're seeing rising infection numbers, but hospitalizations aren't keeping pace. Does it really matter if we hit 100,000 or 50,000 or whatever it is of infections if the hospitalizations aren't rising?
But unfortunately, they are rising, and so are the numbers of deaths, and they will go up as the number of cases go up, because the virus will reach people who are vulnerable and who may get seriously ill. So I think, you know, we can't be complacent about this. This is a worsening situation in an NHS which is already under enormous pressure.
We are hearing a great deal about waning immunity. How serious a problem do you think that is?
I think it exists. I think we are seeing an increased risk, particularly amongst older people who were immunized the longest time ago at the beginning of the year, with an increasing risk that they may be hospitalized. Actually, they're still relatively well protected, but of course there are large numbers of people, and with very high levels of spread of the virus, they are beginning to show up in hospital. The biggest risk, of course, is amongst those who've not been vaccinated at all, including younger adults, not just older people who may get sick. And many of the hospitalized people we're seeing at the moment are in fact unimmunized people.
So for you, the issue is still getting everybody jabbed.
I think that the vaccine program is doing a lot to make the situation much less severe than it would otherwise be. And the vaccines principally are very effective at stopping people from getting seriously ill. They're not so effective, unfortunately, at stopping infections altogether or stopping the virus from being spread about. They do have an effect on that, but they're not by themselves going to be enough at the present time to keep the spread of the virus under control. And we do need to see people continuing to make efforts to avoid contact, to avoid transmission, and to do other things as well as get vaccinated if we're going to stop this rise from going up further.
Let's just clarify one thing about the vaccination programme. The Prime Minister's pinning pretty much all his hopes on that success. Do you think he is right to float the idea of an extension of the booster programme to under 50s and by offering jabs at 5 months rather than the current 6 months and 1 week?
I think we need to be careful that we stick to the science here. Just giving more people vaccines, including people who maybe don't actually need the vaccines yet, could actually run the risk of making things worse rather than better. If you boost people before they actually need the vaccine, it is in some senses a waste of vaccine, but also it means that you're immunizing them earlier and they may make a smaller response to the vaccine, and that response may wear off earlier. So I think the idea of just getting more doses indiscriminately into people's arms is not really necessarily going to solve the problem. I think we do need to focus particularly on the most elderly people and do this in a structured and strategic way in order to have the maximum impact.
So to be clear, you wouldn't move to 5 months, but you would focus on vulnerable groups. Could you elaborate on who you're thinking of?
Yes, certainly. The strategy for the booster program is somewhat similar to the strategy first time around. In other words, to start with the oldest people first and work our way down through the age groups, and at the same time focus on people who are at particularly high risk, who are younger. So it really does mirror what we did first time around. And we do need to do it in that order in order to have the maximum impact. As you get younger and younger, you're getting to people who've got stronger and stronger immune responses and who have been immunized more and more recently. And so you get to a law of diminishing returns, to a point where you're really not achieving anything at all. You're just using up your resources to boost people who don't actually need boosters at this time. But I would like to re-emphasize the fact that the vaccine program by itself, in the current situation, even if things go optimally, it is not, in my opinion, enough to bring things under control. We do need to have people using lateral flow tests, avoiding contact with large numbers of people in enclosed spaces, using masks. All of those things now need to happen if we're going to stop this rise and get things under control soon enough to stop a real meltdown in the middle of the winter.
Professor Finn, that sounds pretty clearly like you think, I know you're not responsible for making policy, but that you think we should move to plan B now.
Well, some kind of plan B. What I think we should stop doing, and I think we did hear this from the Secretary of State from Health last week, is a recognition that giving the message to the population that the problem's all over and that there's no need for any further restrictions or efforts being made to reduce transmission of infection is sending out the wrong message. And I worry, in fact, that the vaccine program itself is suffering as a consequence of this suggestion that somehow the problem's gone and we can all go back to normal again, because that will increasingly make people jump to the conclusion that if they've not been vaccinated, there's no real need to do it. So I do think we need to see a very different kind of message coming from the government now, that there is a serious problem and we all need to continue to contribute to reducing transmission so that we can get through the winter and the NHS can stay afloat. And absolutely, we can avoid lockdowns and the disasters that those bring. We all want to avoid that, but we can't avoid it if we all just go back to normal now.
And would a clear way of sending that message be to reimpose some restrictions, mask wearing, for example, staying away from workplaces, for example?
Well, as you said, it's not my job to create policy. I think this needs to be brought about, whether it can be brought about by clear messaging and communication. I think the British public are, by and large, a pretty responsible lot. And if you give them a clear message of what you want them to do, they will pay attention to that. Whether that's sufficient or whether it actually needs to be done by compelling people, I think that is a decision for the politicians. But one way or another, we do need to bring about a situation where there is less transmission of virus going on in the community. And we can't just rely on the vaccine program to achieve that.
Can I ask a broader question? Are you more worried at the moment about unvaccinated individuals, or about resurgence of COVID, or about the problem of conventional flu, given that there's less certainty this year about the efficacy of the flu vaccine?
Well, I don't see those things as alternatives. I think they're all true. So I'm particularly worried about the number of adults that have not been vaccinated. I'm perplexed that there are so many such people, because they are a very important group when it comes to the number of serious illnesses we're seeing, the pressure on the hospitals. And of course, they are all personally at great risk of serious illness and even death. So those are people that I think we really do need to be concerned about. And we need to focus on the communities where coverage is low and do everything we can to make vaccine readily available and to make clear information available to people so they can make the sensible decision to get immunized. I do think we're seeing COVID cases rising at the moment, not so rapidly in terms of severe cases as before, but of course, in terms of cases overall, very large numbers. And I'm very concerned about flu this year, as is everyone else, because we had no flu last year to speak of. The population is more susceptible to flu. And that, on top of everything else now we're mixing together, could really significantly add to the pressure on the health service. So the flu vaccine program just kicking off is really important too.